Hi, this is Dr. Hutter with another edition of our Facts and Facts. That's chiropractic facts and frequently asked questions. One of the things I want to address today was, again, a diagnostic expression that we use in the medical field that we treat quite effectively here at Hutter Chiropractic. And that's the expression of spinal stenosis. Spinal stenosis is kind of a big word. Many people experience the problem and don't really understand what it is. So let me just give you a couple of ideas to help you better understand what spinal stenosis is. Stenosis is the expression that an opening has been occluded or closed up. If you've ever seen a pipe, a water pipe, something that's been carrying either fresh water or even dirty water, would be a better example, it begins to build up along the edges and you get that gunk inside there, and then the opening itself gets smaller and smaller. Well, that's stenosis, or a stenotic episode within that pipe. And then, the classic rotor-rooter comes in and cleans it out so that the water can flow freely. Well, in your spine, the same thing kind of happens, but it's not necessarily due to gunk flowing through the area. In our body, we have, of course, the bones. The bones are separated so that the nerves, the arteries and the veins pass through these openings. Let me use a different model. This is a little bit bigger, might be easier to see. So where the discs hold the bones apart and act as shock absorbers, we have these openings where the nerves, arteries, and veins come out. And if that opening becomes smaller for any reason, we develop what's called lateral recess stenosis, because that opening would be a little lateral recess. It's on the sides. We have one on the right, one on the left at each level. But then there's something called central stenosis. If we look at the spine as a tube, again, just like that water pipe, it's a tube through which flows the spinal cord. And that spinal cord can be compromised by way of something pressing on it. Most common type of stenosis is due to a herniated disc. Many people have a bulging disc or a herniated disc, and we've done videos on that. You can again go to our website to learn more about herniations. But herniated discs are just one of the reasons why you can develop an occlusion or a closing up of that space. There are ligaments that run the length of the spine, both in the back and the front of that tube. And those ligaments, ligamentum flava, it's called, can become thickened due to repeated injury. It becomes thicker and can take up space. The joints themselves, which are supposed to move, can become arthritic. And just like rust forming on a joint, it can expand and take up space. When it takes up space, it grows into that area and can irritate the nerve. So whether it's a bony occlusion or a soft tissue like a ligament or a disc, either way, the result is that your body is going to experience discomfort and a loss of function. We treat this effectively using our method of spinal distraction, as well as our physiotherapies and anti-inflammatory procedures here in the office. There are those people who don't do well, and of course, if you fail with our conservative treatments, we will work with our local spine surgeons and neurosurgeons to get you the care that you need if in fact we can't get you well using our non-surgical methods. So if you want to learn more about spinal stenosis, go to my website, hutterchiro.com. Again, go to that upper left-hand corner, ID your pain, go to conditions, look up spinal stenosis, and we have areas about the cervical, thoracic, and the lumbar region. You can learn more about it. We've got some great graphics and explanations. So here's Dr. Hutter with more facts and facts. This one's on spinal stenosis. Hope to see you soon.